Welcome back to part 2 of this lecture series. We are going to discuss the principles of developing a clinical practice guideline. By the end of this section, you should be able to explain the principles underlying the development of clinical practice guidelines and describe the steps needed for development. Developing a clinical practice guideline must follow a systematic and transparent approach. The table shows the essential steps that need to be followed in the process. These steps are not necessarily the sequential order. We will consider each of the steps one at a time. First, we need to define the need and scope of the guideline. Clinical practice guidelines can be developed for a wide range of subjects. Since healthcare resources are limited, it is essential to prioritize and attend to the most pressing issues. Factors that may influence the level of priority of a health issue or disease may include the disease burden or the extent of morbidity and mortality imposed on individuals, families, and society, controversy or uncertainty surrounding the topic or supporting data, cost involved, the availability of new evidence with the potential of changing conclusions from previous assessments, the potential of a guideline to improve health outcomes, the demand of an assessment by stakeholders to inform decision-making, and warranted variations in care. Guidelines are appropriate only if the problem or issue is about clinical decision-making or decisions about healthcare services. For example, guidelines may be developed to address the problem of variation in treatment for the same condition if the underlying cause is lack of knowledge or of information. However, if the variation is due to patients' needs and based on sound evidence, outcomes may vary, but developing clinical practice guidelines may not be appropriate in this instance. Again, if variation in practice is a result of resource constraints, clinical practice guidelines may not be the appropriate solution. We also need to address the issue of feasibility. Is there adequate high-quality published evidence to drive the development of the guideline? Are there randomized controlled trials to help answer the question? Are there systematic reviews or meta-analyses? Are there any previous guidelines addressing the issue? It should be noted that the absence of solid evidence just as randomized clinical trials does not preclude the development of a guideline. Expert opinions or judgments may be used where there is absence of evidence, but these need to be clearly stated. There is also the need to properly define the scope of the subject matter. If it is not well defined, the clinical question may be too broad. For example, a guideline on management of diabetes may have to include aspects such as screening, diagnosis, dietary management, drug therapy, management of risk factors, and so forth. Although all of these could be covered in a guideline development, it will take a lot of resources to do so. There is therefore the need for guideline developers to be clear on what is within their scope. One of the desirable attributes of clinical practice guidelines is that they should be developed through a multidisciplinary process. There is therefore the need to convene a multidisciplinary team to oversee their development. Members of all relevant stakeholder groups and those with legitimate reasons for having an input in the process must be included to assure adequate discussion. This will also ensure that the conclusions are not biased in favor of any one particular stakeholder. Members may include representatives of groups such as specialist clinicians, general clinicians, other health workers, consumer groups, health policymakers, health economists, bioethicists, and so forth, depending on the nature of the guideline being developed. All members are to declare any conflicts of interest they may have. Roles of members may include group leader, specialist resource, technical support, and administrative support. There is the need to clearly specify what the purpose and target audience are. The following need to be stated specifically: the conditions and clinical problems that are to be covered, the type of healthcare providers for whom the guidelines are intended, the consumers for whom the guidelines are intended, a description of consumers not covered by the guidelines, the types of settings in which the guidelines may be used, and the interventions to be evaluated. The group must also determine whether or not different versions of the documents are required for different care providers in different clinical settings. One of the purposes of clinical practice guidelines is to improve health outcomes. It is crucial to consider all outcomes that are important to patients when making decisions to use or not to use a particular management option. Outcome measures may differ depending on what is under consideration. Moreover, one should decide on the relative importance of these outcomes, which of them are critical to the decision, and which are important but not critical. Outcomes must be selected prospectively with a defined scope and must provide measures against which the effectiveness of the recommendation can be assessed. Outcomes may include measures such as morbidity and mortality, disease-specific measures, generic measures, quality of life, and other important patient-centered outcomes. After going through all the steps discussed so far and assessing the evidence, which we shall address in the next session, it is now time to formulate the guidelines. The guidelines must be constructed on the basis of the best available scientific evidence of the probable outcomes associated with different interventions. The recommendations must take into consideration the natural history of the disease or condition addressed in the guidelines, the probable outcomes of each intervention taking into account the strength of evidence associated with each outcome, the balance of benefits and risks, a comparison of outcomes for alternative interventions, including conservative or expectant management, and in some instances, an economic appraisal of the best investment for the best health outcome. After formulating the guidelines, they should be subjected to external review to ensure that the proposed recommendations are valid, clear, and applicable. External reviewers should comprise 3 groups of people: those with expertise in clinical content who can review the guideline to ensure the completeness of the literature review and clinical sensibility; experts in systematic reviews or guideline development to review the methods by which the guideline was developed; and potential users of the guideline who can judge whether it's useful or not. Amendments can be made to reflect the reviewer's comments. For guidelines to be effective, they must be disseminated and implemented. The plan for dissemination and implementation must be formulated during the development of the guideline. Any potential barriers to the acceptance and implementation must be identified and strategies devised together with the target groups to overcome the barriers. Guidelines will not be used until they reach the target population. Dissemination strategies include involving potential users in the development of the guidelines, also publishing through professional journals and magazines, making them available to the National Guideline Clearinghouse or other repositories of guidelines, producing short summaries for use in a range of settings, including the internet and websites, engaging respected clinical leaders in promotion efforts, engaging relevant professional societies, engaging consumers groups, and publicizing in the media. It is helpful to inform the target audience that the guidelines are being developed and let them know when they are available, which will ensure that they are distributed and also work with the audience on effective implementation. Dissemination alone will not bring about change and the realization of the goals of the guideline development. Guidelines must be implemented. No one implementation strategy is effective in all circumstances for all people. Some of the strategies to change clinicians' behavior or health outcomes include involving opinion leaders and champions, endorsement by clinical groups, practice visits and audits by influential experts, education of patients, providing patients with information that can raise their expectation and can increase their demand on clinicians to improve performance. Quality improvement activities to promote the implementation of the guidelines, and use of incentives. Guidelines are more likely to be implemented if clinicians have incentives such as financial incentives, recognition from peers, protection from litigation, and so on. Guidelines need to be evaluated and revised as appropriate. How do we know if the development of a clinical practice guideline was worth it? How do we know if the adoption of the guideline is making a difference in clinical practice and health outcomes? Evaluation is necessary to address the effectiveness of guidelines, their dissemination and implementation, as well as the associated costs. It is therefore essential to formulate an evaluation strategy as part of the development process. Guideline development must also include a timetable and a strategy for revision. Revisions can incorporate what has been learned from the evaluation. It is also necessary to incorporate any new evidence into the guide. This brings us to the end of this part, and we'll now have a short quiz.